Let's go to our fourth segment on budget matters.
Hi, I'm Mary Jo Pitzel. I spent 10 years covering politics and policy at the state capitol and currently write about child welfare. I'm here to talk about what's happening fiscally in the nation. We have tax rates going down, but the national debt is going up. And there's expected to be an increase in health insurance premiums as well. That's because Congress late last year passed a tax cut package. It reduces rates, which advocates hope will bring corporations back from overseas and incentivize employers to add jobs and raise pay. Skeptics caution there's not a real good track record to show that that will happen, and fear that the biggest benefit will go to corporate executives and shareholders. The implications for the national debt are expected to be as much as $1 trillion added to a debt that is already $20 trillion and rising. And on the health care front, that tax cut package eliminated the individual mandate that all Americans carry health insurance. That's expected to raise insurance premiums as more people drop out of health coverage.
Okay, let's get to our first question for this segment. Show of hands, do you see the $20 trillion national debt as a significant issue at this point?
Yes. Yes.
Okay. So last night we had the Republicans in here, and many of them said, first off, they agreed that the debt was a concern, but they said that we need to bring down the debt in one of the leading ways that they cited to accomplish that would be to cut into entitlement reforms, do something to bring down costs there. As you know, about 75% of the federal budget involves things like Social Security, Medicare, Medicaid, defense spending, and interest on the debt. So should we change eligibility for Social Security and Medicare? Should we be looking to cut Medicaid or defense spending? How is it that you would propose to bring down that debt? Dr. Tipirneni, we'll start with you.
Yeah, I think the GOP tax bill, it's ironic that it was constructed by fiscal conservatives because there was really nothing fiscally conservative about it. To add on a $1.5 trillion deficit is insane. And it immediately set up their now proposed actions of cutting Medicare, Medicaid, and Social Security. And what really offends me is this term of entitlements and making it sound like people are sitting back just waiting for this. These are things that people have paid into. They have invested in this, expecting the government to hold their end of the contract up, to give them that money when it is time, when they're older, when they're retired. And it is our responsibility to hold true to that contract. Those are not the areas that we should be cutting. The tax bill giving tax cuts to the largest corporations and the most wealthy among us, that was absolutely the wrong thing to do. We should have been focused on middle class, working class families, small businesses that really need a hand up, young people coming out of school, the elderly, the retired folks. That's where our focus should have been. Corporations were the first ones to say we don't need a tax cut, and that money is not going to trickle down to anybody except to their shareholders. We should be focusing on helping the people that really need that help. And ultimately for the GOP now to say that this is now setting us up for these cuts is frankly hypocrisy. And those are things that I'm fiercely ready to protect because we have so many people in CD8 that are counting on Medicare, Medicaid, Social Security, and one area we should absolutely not be cutting, as I think you also mentioned, was education. Those are all areas we should be investing in.
Okay. Ms. Westbrook.
As a child, I grew up with those entitlements. I know the importance of the WIC program. My mother, every single month on the 1st, we did our shopping and loaded our fridge up. So we shouldn't be cutting them. But what we should be doing is instating policies that lift people out of poverty, addressing the concerns of this district. People living below the poverty line has increased every single year in Congressional District 8 over the last few years. And there's more people living today below the poverty line than there has been in a long time. And it started right after Reaganomics. Trickle-down economics does not work. We need to repeal this tax scam and put in a bill that builds a good foundation that we can build from the lower class up. We need to create a jobs bill, fix our derated infrastructure, put more Americans to work so entitlement programs won't be a need. We need to create more jobs. We are severely lacking other first world nations throughout the world as far as our infrastructure rating. Last I checked, we were close to 10, and we should be leading in all areas. We are the United States of America, so we should not be cutting any programs. But what we should do is balance the budget appropriately to the needs of our country, to a reflection of the United States of America's people. That's how we should balance it.
Okay. Next question will go with you, Ms. Westbrook. President Trump has long sought to repeal the Affordable Care Act, and the tax cuts that were passed last month included taking away the individual mandate. As a practical matter, if you win this race, you will go to Washington with a House and Senate and a White House controlled by Republicans at the moment. They are looking to do away with the ACA, not expand health care coverage. What else, if anything, would you seek to do on health care during the Trump administration?
Well, when elected to serve you, I will be one more vote for Medicare for All. We already have a bill on the House floor, H.R. 676. There's over 130 co-sponsors on it already. We just need to take back the House so we can send that to the Senate. That's the only direction we can go as a nation for our healthcare system. And the discussion's already started. We just need people to champion it, to get it through the House and get that put into law.
Dr. Tipirneni.
This is an incredibly critical issue, and certainly really the main issue that propelled me into this race. You know, healthcare is a right, and it's a moral imperative for me. And I know that we can get to the goal of universal coverage, but we have to make it a priority. And what has been done so far has taken us backwards. The ACA was never intended to be the final solution. It was intended to be one stepping stone towards a final goal. What we should be doing is strengthening and stabilizing the ACA, keeping the parts of it that everybody agrees on, like letting kids stay on their parents' plans up to 26, making sure that there's no penalties for pre-existing conditions and age, making sure there's no junk plans. And then the next step is expanding Medicare. Let folks from 50 to 64 buy in. That allows some of the folks who accrue the greater resources to come out of that pool and drops premiums for other people, and allows those people approaching retirement to put a little bit more away for retirement. Our goal should be delivering quality, affordable health care for every single American, and I know that's a goal we can get to, but we have to focus on it, and that's why it's important to elect people with diverse backgrounds like my own in healthcare that understand policy. They have to have a seat at the table to inform good policy.
Okay. We'll go to our next wild card question. This is for you, Ms. Westbrook. Your personal story is clearly about adversity and taking non-traditional paths in life and raising yourself up. That's commendable, maybe even inspiring. But is it a background that has prepared you for Congress? Mr. Franks, for example, was a member of the Armed Services Committee in a district that includes Luke Air Force Base. The question is, what training or life experience do you have that has prepared you for Congress?
Well, what's prepared me for Congress is our United States Constitution. Being a representative is about being a servant. I'm just the voice. Being a representative in the House is just being the voice for the district. I want to go there and take our district's concerns and address them in Washington, D.C. to propel our district forward. When elected to serve you, I will have the brightest minds around me, and I will lean on them for their support. One thing I've done in my career, and it's made me successful, is asking questions. I know how to ask the right questions to create progress, and I will do that in Washington, D.C. And the Constitution says that I can do this.